Okay guys, so I've heard this question about 1,000 times. Dr. Truesdale, I love your work. I want to find a plastic surgeon to do a deep plane facelift or one of your procedures, but I don't live in California and I can't travel to see you. Help me. How do I find a plastic surgeon near me? How do I go about finding a plastic surgeon? First off, even if you don't live here, you can still come and see me because over 80% of my patients fly in from out of town. So we have a full protocol for this. Even if you're out of the country, you can still come and see me for plastic surgery. Now, if all else fails and you really can't come and see me, let's talk about how I would go about finding a plastic surgeon if I were you. The first thing, credentials matter. Super matter. Credentials are how we show the world what our dedication level is, right? It shows our experience level. It shows that other peers have actually evaluated us and we have a fundamental body of knowledge that is necessary to perform safely and knowledgeably in this specialty. And so in the realm of facial plastic surgery, there are two big boards, right? You want to look for board certification. First, there is the AAFPRS, or the American Academy of Facial Plastic Surgery, is what I have my board certification in outside of otolaryngology, head and neck surgery. And this board basically has shown that it's the gold standard, right? If you have done extensive training and you've shown that you have a lot of knowledge about all aspects of facial reconstruction, as well as cosmesis, this is the board that a lot of people go under. This does not mean that if your doctor is board certified that they are a good doctor or should be your doctor. This is just how you get into the club, right? This is just the entry fee. This doesn't mean that you bought a table. This doesn't mean that you are the one, but they should at least have this. The second one is the American Board of Plastic Surgery. Now, there's two different paths to getting to what I do. Kind of three. The two that you should be looking at is either they should be a legit plastic surgeon or a legit facial plastic surgeon. Now, you can only call yourself those things if you're board certified. If you are a cosmetic surgeon, if you are a dentist, if you are an emergency medicine doctor, if you're an obstetrician who's doing facelifts, you can't say that you're board certified. You can't actually call yourself a plastic surgeon. So if you're looking at people and you don't see those two board certifications, if you don't see their training, don't even go there. Why is this important? When you do a procedure, it's not just important to know the steps of the procedure. You want to have seen that procedure hundreds, maybe even thousands of times. You want to know how to deal with the nuances. What if this happens? How do you deal with it? When a person comes to me and say they have an infection, listen, I can drain it, I can identify it, I can diagnose it because I spent years as a head and neck surgeon thinking about those things. I know all of the compartments of the face. I know how to get there. I know the imaging modalities. I know how it relates to the vocal cords, the larynx, right? The deep spaces of the sinus, the brain, all of those things are within my wheelhouse. If I was delivering babies for 5 years, 10 years, and then I go and do a facelift course, and then I do your facelift and you say, listen, I have jaw pain and I can't open my mouth, and then you have an obstruction and then you die, that's on you and me. So that is not acceptable. A lot of these horror stories that we see in the media where people have had really bad outcomes, it means that the surgeon didn't know how to deal with the complication. It's not enough to just know how to do the surgery. You have to know what to do if things are right and wrong. And that's where the certification and the experience come into play. Number two, the experience is more than that. If you do a facelift every month or every 2 months, yes, you can do a facelift. But if you do a facelift every week, every day, then you're putting in reps. Those reps lead to mastery, lead to understanding how to do it better if you're actually reflecting. If you're not thinking about it and you're just doing it over and over the same way and not trying to improve, then yes, you're not going to get any better. In something like your face, in something like a facelift or eyelid surgery, you want to see that the surgeon is busy. Every surgeon has to get there. Listen, I started off, I wasn't like super busy, but I got there very quickly. It also helps when you come from a really good training background, right? I went to a great fellowship. I went to one of the top head and neck surgery residencies in the country. I went to one of the top medical schools in the world. And so all of those things compound because if you're operating at a high level, the steel sharpens steel. At the end of it, you are going to be stronger, you're going to be better, and you're going to take better care of patients. So that's super important. Experience does matter. Now, like I've heard hate, right, online. What is the optimal age for your facelifter? There's there's some truth to this. You want your surgeon to have experience, and people will argue that experience only comes with age. But listen guys, I do have gray hair, but I don't have that much. It goes beyond that. You can be young and high volume, and that's like a person like me, right? I do a facelift almost every day of the week, sometimes two. That means that even though one person might do a facelift every month, I've condensed down years of experience in a couple of weeks, guys. And so if you do that week after week, year after year, it's almost like dog years, right? Like I might be a surgeon in his 60s based off of that kind of metric. Now, if you're going to a surgeon and they're young, yes, they might have a little bit better eyes, their hand movements, but in essence, it takes time to see complications. And so this is where the point of, if your surgeon is a little bit older, maybe they've had a chance to see complications and deal with them. I'm a firm believer in learning from the failures and the experience of others. Just because I didn't drop out of high school doesn't mean that I can't learn from people who did. And so I don't necessarily agree with the idea that I have to go through pain and suffering to become better. I can listen and stand on the shoulders of giants. I can maybe phone a friend, another person who maybe he's experienced or she's experienced this before, and I will learn from them. So that's where the training piece comes in. It's nuance. It's not just about time in the game, because just being in the game and having a complication doesn't mean that you're going to be better for it the next time. It's really about when you are trying to approach what we do, which is super hard, super high level, you're always trying to do the best. And if you don't have the answer, you better go find it, because the patient is the person holding the bag, right? Okay? If I was looking for a plastic surgeon, I would want them to be an artist, or at least be able to show beautiful before and afters over and over and over and over and over. And so guys, when you look at one result and then you look at another, and there's something different about the other where it almost looks like magic, where it's like, how did they do this? It goes beyond just, was the jawline clean? The jawline should be clean. The contour should be as smooth as possible. The asymmetry should look better. If they said they did a brow lift and an upper blepharoplasty, you should see a difference in the eyes. If they say they're doing a lip lift, it should look nice and pretty. It shouldn't look crazy, right? If they're doing a facelift, you should see more definition in the neck. The jowl should look better. If they're doing fat transfer, the contour should look better. And if you're not seeing that in the results of the patient, I don't know if you can expect that yourself. So that's really important. I can see a facelift and it be good. Then I see a facelift and it's like, that's really good. I wish I did that. That is where I think the nuanced, high-level technique, but also the artist decision-making and the surgeon artist really comes into play. So look for that. If you don't see that in their results, don't go there. Ask the surgeon, do you do revision work? If the surgeon says no, then they probably should not be doing your facelift or your facial plastic surgery. And the reason why is revision work is harder and it is more challenging. It also means that the person has enough experience so that they have to do their own revisions. Listen, if I do a facelift for someone and then they need, like, listen, it's not quite fully tight or there's something wrong, I should be able to fix my own work. And if the surgeon just, listen, I don't do revision work, and they're just turning it away, that might be showing that they have a limitation, that they feel like they just can't handle it. That might be honest, and that might be a good thing for you, right? It's knowledge in your journey, right? It's data. But it also means maybe I should go to someone who actually does revision facelifts, because to do a revision and to make that beautiful, it's not the same game as a primary surgery, right? You have to be better. You have to know the anatomy. You have to deal with other potential complications. And so if you can do those things, you are slick. You're a good surgeon. And so check that out. Ask that. Reputation and transparency. When you come to me and you want to know what I charge, listen, I know I don't put it out there on the internet so much, but if you call my office, they will tell you how much my facelift is, guys. Part of the reason why I don't say it out loud, because these videos are evergreen. They're always out there and my facelift price changes, right? So it's like, if I say one thing online and you think that that is what it is, and then you call the office and it is not that, you're gonna be mad. And I don't want people mad at me. So that's part of the reason why we don't do it, guys. But if you go to the surgeon's office or you call them, they should be able to tell you what the price is. It shouldn't be shifty. It should be transparent. The other thing is, high price does not mean that the facelift is going to be good. And likewise, just because the price is low doesn't mean that the facelift is going to be good or bad. So it's really up to you to look at some of the other factors, right? Now, it needs to be in your budget. No one wants to see patients financially ruin themselves for getting plastic surgery. That is not the goal. That is awful. In fact, I'm fully against that. But you want to try to get the best that you can for what you have. Sometimes that means going a little bit more in terms of what you pay so that the result that you feel that you can get is a little bit better. Let's be honest, some of the best facelifters in the world are not cheap. If you go to someone who's a little bit more budget, it doesn't mean that they're gonna give you a better result, but the results speak for themselves. Reputation matters. If you go on Google, you'll see hundreds, literally hundreds of 5-star reviews for me, right? You might see negative reviews, but if you weigh the difference between positive and negative, you look at the review for yourself and you judge it. Is the person unreasonable? Is it something, hey, listen, this is plastic surgery. We are not perfect. Sometimes things are gonna happen that are not what we want. The most important thing is, how do I respond to that? How do I try to make it as good as I can to make the patient happy? And so that's what's important. People will have negative reviews, but if you only see negative reviews, or if they have 3.1 stars or 2 stars, guys, this is not just a steak dinner. This is your face. And so take that very, very seriously. It's very important to evaluate that. Okay, one of the last things that I will mention is your personal connection with the surgeon. If you go into the surgeon's office and it's stuffy and the staff is not feeling it, the staff hasn't had any work by the surgeon, red flag. Because when you go through the process and you've paid for your surgery, you're gonna be interacting with this staff. If they're not nice, it's not a good customer service experience. Now, people will say, oh, he's so mean, he must be a good surgeon, because there's no way that he could be a meanie and also not a good surgeon. Guys, that's not the way it works. Your surgeon should be affable, because listen, you're going on a journey with them where your face is being opened up. If you can't trust what they say, if they can't communicate to you, if you don't feel a connection with them, do not, I pray, do not sign that dotted line, because what that will mean is you're already beginning a very deep relationship with someone that you know is not your soulmate, right? I'm not trying to make it too deep, but it is deep, right? It's a facelift. They are basically the shepherd of your health and also have the ability to maim you or just not make you look natural. If you don't feel that connection, there are enough options out there that you can find someone who is. I might not be that person. I hope that I am. I hope that you see my content and you love what I do. But if someone else you vibe with more and they have all those other criteria that we were talking about, by all means, go and live your best life. I want you to have the best plastic surgery experience you can, because if one patient has a good experience, it elevates the game for all of us. So guys, hopefully you've learned a little bit about how to choose a plastic surgeon. This is very comprehensive, and I hope that you choose a good one if you don't choose me. All right, I'll see you soon. Bye.